Now turn over and look at the notes for extract 1.
Mr. Murray, I'm Dr. Corbett.
Nice to meet you.
Yes, sir. Nice to meet you. Yeah, first time we've met.
Yes.
Yeah.
Yes.
So I understand you made an appointment for an examination.
Yes, correct.
And we're going to, a complete physical examination, I understand. Yes. And I'm going to ask you about why you came into that, but will you mind if I take a few notes just in case?
No, that'd be fine.
In case you got lots to tell me.
Yeah.
Don't want to miss too much.
That'll be fine.
Good, good. So you made an appointment for an exam. When's the last time you had a physical examination?
Probably 2 years ago.
2 years ago.
Yeah.
Okay. Well, tell me why you made this one.
Well, I had these chronic headaches going on that I've had for about 3 months now, and they're just not getting any better, and I want to see if there's something we can do about it.
So when you say chronic, you're referring to the fact that they've just been steady for 3 months, or they've been longer than that?
Well, it started 3 months ago, and they're like every other day or so, and now I'm having them every day. And
so you have no days when you don't have a headache?
I have a headache every day.
But at the beginning, it didn't seem to be quite as noticeable then for you, huh?
No.
Describe the headaches. Where are they, and what do they feel like?
They start at the back of my head here, and they kind of come up around my temples, I guess you call it, and into the front of my head. Sometimes they're throbbing. Other times they're not quite as bad.
Yeah. So it's both sides of your...
Yes.
It starts in the back and comes up the front.
Correct.
Do you have a headache all the time, or does it just come in episodes?
Well, I have a headache all the time until I take something. I take Advil and Tylenol that seem to help it, and that eases it up.
Is it ever gone? Is there always something there?
There's always something there. I always know it's there. It's just the intensity of it.
I see. Can you tell me a little bit more about what you notice? For example, when is it the worst? At night, in the morning? Or doesn't make a difference?
Well, it doesn't make a whole lot of difference. When I don't get enough sleep, it's really bad. If I move my head in a certain way, or if I strain or stretch my head in a certain way, it seems
like
quite
what
worse.
way? Can you show me that?
If I go like, to the back, or if I'm, bending over, just any exaggerated moves.
Any exaggerated move makes it
seems to make it worse. And if I don't take the Advil and the Tylenol, it seems to be worse.
I see. So this 3 months ago it started. It's both sides. It's in the back, and you can make it worse if you either extend or lean forward for too long.
Yes. Just I call them exaggerated head movements.
Yeah. What happens when you're lying down? Does that ease it or make it worse?
I think that eases it some.
It does.
Especially if I can get some sleep.
I see.
It seems to ease it up some.
So the act of lying down and sleeping doesn't make it worse?
No, I would
makes
say.
it better, maybe?
Yes.
I see. Does it change based on if you're eating, for example?
No.
Does eating make it worse or better?
No, eating doesn't seem to.
So having the full stomach doesn't seem to
No.
bother at all. How about if you're concentrating? Is when you're driving? Or reading?
No, it doesn't make it worse, except when it's really bad. I have a hard time focusing.
Okay. Yeah, that's helpful.
Yeah.
Does it ever seem to be more one side than the other?
No, it always seems to come up and be just kind of like meets in the middle.
Meets in the middle, huh? Or all over?
I would say in the back.
In the back
Yeah.
there, too.
It always starts in the back. I got rear-ended in a car accident, and I can remember my neck got jerked, and I had a sore neck for a couple days, and then the headache started shortly after that.
So that accident started this thing off.
That's when it all
So
started.
you had no headache before this?
No, I had no
That's helpful.
previous headaches.
So tell me about that. How fast were you, were they going?
Well, it wasn't very fast. It was in a parking lot, and I was backing out, and somebody else was backing out the other way, and we met. And I just remember that jerk of my head
Gotcha.
and having a stiff, sore neck.
So both cars couldn't have been going more than startup?
Yeah.
Okay.
5 miles an hour or something like that.
Did you strike your head when that happened?
No.
That you recall?
Not that I recall.
Yeah.
I just remember kind of being, I guess they call it whiplash.
Did you get out of the car right away?
No, I sat there for a few minutes, and then I got out of the
Did
car.
you?
It startled me.
Did you?
Yeah.
Then you said the headache started after that. How long after the actual accident did the headache start?
3 or 4 days after.
So it wasn't right away. There was a
Wasn't
little
right
bit of a
away,
warm-up.
yeah.
There was a kind of an interval in there where you felt
Yes.
fine. I see. Did you think that you had hurt yourself?
I didn't think I really had hurt myself. I didn't, I felt startled and, just kind of shaken, but I didn't feel like I was really injured.
But didn't. Okay.
I didn't go to the hospital or anything like that.
Yeah. Have you? And you said you take some things for it. What actually helps it? What do you?
Tylenol and Advil. I take, I guess it's,
How much do you take?
I take a lot. I take 16 Advils, 4 tabs, 4 times a day,
Wow.
and I take,
Self-prescribed?
yes, 2 Tylenols 4 times a day. So I'm taking
8 Tylenol and 16.
24 pills a day.
Wow. I take it you warmed up to that you weren't using
Right.
that.
I started out
I
with
see.
less and it wasn't working, so I
I
just
see.
kept adding to it, and it does give me some relief.
It's a lot of medication.
It doesn't, yeah, it seems like too much. That's one
Does
of
that-
the reasons I came to see you.
Good for you. Yeah. Does that mean it just keeps getting worse?
The headaches just kept getting worse in the severity of them, yes.
Yeah. That's a lot of medication.
Yes.
Before you had this accident, did you use those medications much, if at all?
No, very seldom.
No, never had to take that kind of thing with
No.
any regularity?
No.
Okay, okay. I need to know, too, what else do you experience? Anything else? Does this make your body feel different or painful or uncomfortable in any way?
It makes me feel stressed. I feel stressful with it. I can't sleep well. It's uncomfortable.
Yeah.
It's just kind of a nagging thing that's there all the time.
Does it bother your shoulders, your arms? Do you feel anything down here?
No,
Strength,
pretty good.
tingling?
No.
How about just being able to use your arms in normal motion?
Yeah,
That's not disturbed at all?
No, that's fine.
I see, I see. Wow, so you had an accident, took a couple of days for this thing to get to you, 3 or 4 days, but then it started bothering you and persist, and now almost has this stubborn worsening. Is that what I'm...
Daily.
Daily? What kind of work do you do?
I work in a car dealership. I'm a service manager.
Oh, yeah. So has this had an impact on your ability to just do your normal stuff?
Well, again, it has in that it's uncomfortable. I feel stressed because of it. I'm able to do my job. I like my job.
So you can do your work? Have you missed any days from work?
I think I missed 2 days in the beginning, but I've been at work since then. I'm able to go to work, but I make sure I have my Advil and Tylenol with me. Other than that, I'm
You
working.
sound like a great
okay.
employee to me. To work through this kind of thing is pretty difficult.
Well, I like what I do. I work on vintage cars on the side.
I see, yeah.
So I
Okay.
try to make it.
I have a sense of what you're telling me. What's your diagnosis?
I don't know if I did something to my spinal column back there. I don't know what you guys call it, but something happened when I got hit, is what I think. A jerk did something. Other than that, I don't know what it is.
But you're fairly sure there was a couple of days in there where it wasn't obvious to you that there was anything wrong?
Other than it just being sore.
Okay.
It was sore and stiff. But the headaches didn't start, like I said, until about 3 or 4 days later.
So there was some discomfort
Yes.
right
there
away.
was.
But you would call it more a soreness or stiffness
Yes.
than actual headache like you're having
Right,
now. Okay.
right.
Gotcha, yeah. I need to know a few more things
Okay.
about the effect of this on you. How's your sleeping? Do you sleep okay?
I don't sleep well at all.
Why not?
The headache, the discomfort, it's hard to get to sleep. I sometimes can get to sleep and then the headache wakes me up. So my sleep patterns have been totally
So that's
disrupted.
So how much sleep are you getting at night compared to what you'd like to get?
Well, I used to sleep the night through, which was probably at least 8 hours. And I'm probably up 3 and 4 times a night now.
Wow. And how long is that, I would call it a sleep deficit, how long has that been going on?
Well, this happened 3 months ago, probably 2.5 months now. Because it wasn't as bad in the beginning, but they did just get worse.
Did you consult with anybody else, or you've been just toughing this out on your own?
I've just been toughing it out on my own and trying to, hoping it will go away, but it's just getting worse.
But you haven't been able to do your work, think, use your hands?
Yes.
Nothing disturbed in that way, huh?
No.
Gotcha. Anybody else know? Did your wife, are you married?
Yes, I am.
You've been talking to your wife about this?
She certainly knows.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come on in, Henry. How are you this morning?
Not too bad, thanks, Doctor, and yourself?
Oh, well, busy as usual.
Yeah, I can see that. There are a lot of customers in the waiting room.
Yeah.
There was a nice spot of rain we got last night.
Yes, it certainly saved watering the garden, and that was a bonus. So, Henry, have you come for your blood test results?
Yeah, that's right. Give us the news, Doctor.
Well, it's not bad news, but your total cholesterol was 6.6, your triglycerides 1.6, and your HDL was 1.54, and the LDL was 4.65.
So what does that all mean, Doctor?
Well, you remember we did the same test a year ago?
Yeah.
So what these current results show now is that compared with last year's results, there has been a sharp rise in your LDL level.
Yes, well, what's brought this about?
Well, as we discussed last year, cholesterol is carried in the blood by different types of protein carriers called lipoproteins.
Yeah, I remember that.
Well, the two which carry the most cholesterol are the low-density lipoproteins, LDLs, which we believe promote atherosclerosis or thickening of the arteries, while high-density lipoproteins, HDLs, tend to prevent this. In your case, unfortunately, your LDL has increased, and there are a number of factors that may have contributed to the rise in your LDL. For instance, a higher fat content in your diet,
Right.
increase in stress,
Mm-hmm.
maybe you're not exercising as much as you were.
I guess I'm not.
That's right. Have you noticed any discomfort or had any general health issues that have caused you concern lately?
No, not really.
Okay, now Henry, I know your family history and that your dad died of a stroke at 60. I just want to ask you a few questions about what you're doing now.
Sure.
What about your current diet? Are you eating much fatty food?
Yeah, I guess so. I mean, I do enjoy McDonald's at lunchtime and eat quite a bit of meat. I'm not really a big fan of vegetables.
Yeah. Have you noticed any change in weight? Do you think you've gained a little?
Well, since I last saw you, I've probably put on about 5 kilograms.
Yeah, well, that's quite substantial. What about exercise? Do you still manage to do that regularly? I remember last time you told me that you were taking your dog for a run once or twice a week and that you swim regularly.
Well, actually, in the last year I've been pretty busy at work and I've had a lot of family commitments lately, so I'll probably exercise a bit less.
And are you still smoking?
Yes, I am. I've tried to cut down though. I'm probably smoking 5 or 10 cigarettes a day.
Okay. And how about alcohol? How many alcoholic drinks do you have in a week?
Well, in a week, I probably have 2 or 3 a day, so I don't know if you multiply that, I guess it adds up to quite a few, 16 or more maybe.
And would you say that you drink more at the weekend?
Yeah, a little bit more on the weekend. We have a glass of wine as well at night sometimes.
Right. Okay. Well, what about your work? Is it any more stressful?
It is actually. Since that economic downturn, we've all been putting in longer hours, trying to drum up a bit more business, so I guess it is a bit of a stressful time.
Okay. Well, judging by what you've said, I'd say there are a number of things that certainly could be impacting on your health. Now, Henry, based on what you've told me, you do have some risk factors, and I'd like to talk to you about ways we can minimise these, if that's okay.
Sure, Doctor.
So the best way to maximise healthy levels of your cholesterol is through diet, of course, and taking account of the things that you need to avoid.
Yeah, I see.
So let's talk about some simple dietary measures. Firstly, of course, you should try to avoid fatty meats and processed meats like salami, sausages.
Okay.
Also, you need to cut down on snack food, such as chips, hamburgers, all those little things you probably love.
Yep.
And takeaway food, of course, especially deep fried food. I don't know whether you have a lot of takeaways.
Well, I do. So you mean no more McDonald's, Doctor?
That's right. It certainly would be better to avoid it. Just try it grilled instead.
Okay.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now, look at the question 25. You hear a discussion between a nurse and a physician explaining about ingredients used in a vaccine. Now, read the question.
Hello, doctor. Can you explain what ingredients are used in a vaccine?
Well, chemicals used in a vaccine include a suspending fluid, such as sterile saline or fluids containing protein, preservatives such as glycine, albumin, and phenol, and enhancers or adjuvants to improve the effectiveness of the vaccine. Some vaccines may also contain trace amounts of the culture material for the growth of the virus or bacteria used in the vaccine, such as chicken egg protein. Even trace amount chemicals added to vaccines to deactivate a bacteria or virus and stabilize the vaccine and to keep the vaccine potent over time. Question 26. You hear a discussion between a nurse and a physician explaining about vancomycin-resistant enterococci. Now, read the question.
Hello, doctor. What are vancomycin-resistant enterococci?
Vancomycin-resistant enterococci are particular types of antimicrobial-resistant bacteria that are resistant to vancomycin. This is often used to treat infections caused by enterococci. Enterococci are bacteria that are normally present in the intestines and in the female genital tract that are commonly found in the environment that can cause infections at times. Most of the times, vancomycin-resistant enterococci infections occur in hospitals. Often the infection is caused in patients with chronic diseases such as diabetes or who have recently received antibiotics. It's also more common in patients with indwelling devices like intravenous lines or urinary catheters and those with compromised immune systems. Vancomycin-resistant enterococci can cause many types of infections such as urinary infection, heart infections called endocarditis, bloodstream infection called sepsis, abscesses, wound infections, pneumonia, or meningitis. The risk of vancomycin-resistant enterococci infection can be reduced by minimizing the use of indwelling devices such as intravenous lines and urinary catheters. The risk can also be reduced by avoiding inappropriate use of antibiotics. Question 27. You hear a discussion between a nurse and a physician explaining about the causes of Shapara hemorrhagic fever. Now, read the question.
Doctor, how are the Shapara hemorrhagic fever is caused?
A single-strand RNA virus called a Shapar virus of the Arinaviridae family causes Shapar hemorrhagic fever. Shapar virus is animal-borne or zoonotic infection. Limited clinical trial information about this infection in rural Bolivia. Like any other arenavirus, rodents host Shapar virus as a reservoir. Humans can contract this infection with a contact from an infected rodent. It can be direct or through inhalation or aerosolized Shapar virus from the feces or urine of infected rodents. Although there is a possibility of person-to-person transmission of arenaviruses through aerosolization, it's very rare. From the very limited observed cluster of cases of Shapar hemorrhagic fever, there was hardly any evidence of person-to-person transmission. Question 28. You hear a dialogue between two physicians discussing about toniasis. Now, read the question.
Hello, doctor. What is toniasis?
Toniasis is a parasitic infection caused by the tapeworm species pork tapeworm, or Tinea solium, beef tapeworm, or Tinea saginata, and Asian tapeworm, or Tinea asiatica. Typically, people become infected with these tapeworms by eating raw or undercooked pork or beef. Often, individuals with toniasis infection may not know they have an infection because symptoms are non-existent or mild. Especially pork tapeworm infections can result in cysticercosis, a disease that can cause seizures. Question 29. You hear a monologue by a physician briefing about rickettsiosis. Now, read the question. A group of diseases called spotted fever group, rickettsiosis, is called by closely related bacteria. Through the bite of infected ticks and mites, these bacteria spread to people. The most severe and commonly reported spotted fever group, rickettsiosis, is in the Rocky Mountain spotted fever. Other causes of spotted fever group, rickettsiosis, in the U.S. include Rickettsia parkeri ricketsiosis, caused by R. parkeri ricketsiopox, caused by Rickettsia akari. Pacific Coast tick fever, caused by Rickettsia philippi. Question 30. You hear a dialogue between two physicians discussing about healthcare-associated infections. Now, read the question.
Doctor, what is the cause healthcare-associated infections?
Different types of healthcare-associated infections, including pneumonia, wound, bloodstream infections, or surgical site infections, and meningitis caused by Klebsiella, is a type of gram-negative bacteria. Increasingly, Klebsiella bacteria have developed antimicrobial resistance, and very recently, it has developed to the antibiotics called carbapenems. Normally, Klebsiella bacteria are found in the intestines, where they do not cause any disease. They are also found in feces. Commonly, Klebsiella infections occur among sick patients in healthcare settings, patients whose care needs devices such as ventilators or intravenous catheters. Moreover, patients taking long courses of certain antibiotics are at high risk for Klebsiella infections.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best, according to what you hear. Complete your answers as you listen. Now look at extract.
I wrote a prescription for antibiotics. I did want to talk to you, though. I'm a little bit concerned looking through his chart at how many ear infections he's had recently, and I noticed that you had checked the box that someone's smoking in the home, so I was wondering if you can tell me a little more about that.
Well, it's just me and him, and I do smoke. I try really hard not to smoke around him, but I've been smoking for 10 years, except when I was pregnant with him. But it's so stressful being a single mom and having a full-time job, and so it's just, that's why I started smoking again.
You have a lot of things going on, and smoking's kind of a way to relax and de-stress.
Yes, yeah. Some people have a glass of wine, I have a cigarette.
Sure. And it sounds like you're trying not to smoke around him. Why did you make that decision?
I know it's not good for him. I mean, I've read those things about ear infections and asthma and stuff, but other kids have ear infections and their parents don't smoke.
So on the one hand, you're worried about how your smoking might be affecting him, and on the other hand, you're not so sure if it's really the smoking that's causing these problems.
Right. Yeah. I mean, he doesn't have asthma. He hasn't had a lot of other problems that his other friends have. So, and I've thought about quitting before in the past, but I just don't see how it's possible right now.
What made you decide to quit smoking when you were pregnant?
Well, he was inside me, and we were sharing everything, and I knew that he would get some of that, and I just didn't think I could live with myself if something happened to him.
Right now, though, it feels almost too difficult to even manage or even to try.
Yeah, exactly.
How were you successful when you quit before?
I don't know. I think about it now. I don't even know how I did it. I just did it. You know, I just couldn't imagine like him not being born or going into labor early and him having problems and stuff like that. All the stuff that they talk about with women who smoke. So that was just enough to say, okay, you know what? I'm not going to risk that. Mm-hmm. So
the risks were so scary then that you're able to stop.
Yeah.
They don't feel as scary to you now.
No, I mean, we're two separate people, and like I said, I try really hard not to smoke around him. I'm pretty good about that. I don't let other people smoke around him. So
You're doing the best you can do.
Yes. Yeah.
Okay, but it sounds to me too like part of you really does want to quit.
Yeah, I know that I need to, and I keep every new year I say, okay, this year I'm going to quit smoking, but then something happens and it just doesn't.
It's on your to-do list. It's just not making it to the top.
Yeah.
If you did decide to quit, on a scale of 1 to 10, where 1 is not at all confident, you don't think you could do it, and 10 is you feel pretty certain that you could, where do you think you fall right now?
Probably like a 5. Kind of in the unsure area. Mm-hmm. Like, I know I've done it before, so I know I can do it, but at the same time, it just seems really hard, and it's not the same situation.
Well, what made you say 5 rather than 2 or 3?
I know all the ways it's bad for me, and I don't want him to grow up thinking that it's okay to smoke. I don't want him to use any kind of, I don't want him to chew or anything like that. So I know I need to, especially before he gets old enough to understand what mommy's doing, but I just don't know if I can do it.
Okay. So it sounds like you have a lot of reasons why you'd like to quit. You have been successful quitting in the past, and right now you're just feeling a little bit hesitant about your ability to do it.
Yeah.
Where do you think we should go from here?
I don't know. I'd like some help. I just don't know what kind of help I need.
Sure. Well, if you'd be interested, that's something I can definitely talk to you about. There are a lot of new options that can actually help people be way more successful in their attempt at quitting. There's different medications you can try.
I don't like medicine.
Okay. There's also a lot of support groups and classes that you can take where you have other people to go through it with you, and sometimes just having that support can be a big part of it, especially for people like you where smoking is such a stress reliever.
That sounds nice, but I'm not sure if I have the time for all that.
Sure. It feels like something that would take up a lot of time and maybe not fit into your life. I wonder if we could talk about some options that might fit into your life.
That would be really nice.
Okay, well, if you're willing, then we could set up another appointment where you could come in and we could talk more about that.
I would like that. That would be great.
Great.
Thank you.
Sure.
Now look at Extract 2, questions 37 to 42. You hear the discussion of a physician with junior doctors on different types of hernias. You have 90 seconds to read questions 37 to 42.
Hello, doctor. Could you please explain to us about different types of hernias?
Well, inguinal hernias are located in the lower abdomen just above the leg crease, adjacent or near the pubic region. At times, they can also occur on both sides of the pubic area, which is called bilateral inguinal hernias. Inguinal hernias, along with femoral hernias, make up the two types of groin hernias and can cause pain that extends into the upper thigh or scrotum. Inguinal hernias can be categorized as direct or indirect. An indirect inguinal hernia occurs due to natural weakness in the internal inguinal ring, while a direct inguinal hernia caused due to the weakness in the floor of the inguinal canal and is more likely to develop in men above 40. The floor of the inguinal canal is located just below the internal inguinal ring. When inguinal hernias are repaired using the tension repair technique, recurrence rates may be more than 15%. However, other techniques used for hernia repair, such as tension-free and laparoscopic tension-free, have much lower recurrence rates of just 1%. A sportsman's hernia is a condition of chronic exercise-related suprainguinal groin pain. Generally, it involves a direct inguinal hernia. Femoral hernias, along with inguinal hernias, are groin hernias, which are very common in women but can occur in men as well. A weakness in the lower groin makes the intestinal sac to drop into the femoral canal, a space near the femoral vein that carries blood from the leg. These hernias are highly prone to develop incarceration or strangulation as an early complication. Incisional hernias appears in the abdomen at the site of a previous surgery that can appear weeks, months, or even years after a surgery and can vary in size from small to very large and complex. Umbilical hernias appear near the belly button or navel due to a common weakness from the blood vessels of the umbilical cord. This may occur in infants at or just after birth and may resolve by 3 or 4 years of age. However, in adults, umbilical hernias will not resolve and may progressively worsen over time. Epigastric hernias are more common in men than women. They occur due to a weakness or opening in the muscles or tendons of the upper abdominal wall on a line between the breastbone and the navel or umbilicus. Spigelian hernias, a protrusion of intestine or an empty sac through a weakness between the muscle fibers of the abdominal wall, often on the right-hand side of the abdomen. It becomes impossible to detect because often there is no obvious swelling or lump. It develops between the muscles of the abdominal wall rather than protruding through layers of fat. It often develops in later life of men and women when the abdominal muscles become weaker. Hiatal hernias are slightly different from other types of hernias because they are a weakness or opening in the diaphragm that separates the chest cavity from the abdominal cavity. These hernias cause reflux of acid from the stomach into the esophagus, resulting in heartburn, pain, and erosion of the esophagus. That is the end of Part C. You now have 2 minutes to check your answers.